last year it was 3%, but the previous year it was 8% where it was child-to-parent violence. But I'd be interested now, looking at it last year from us, it was 72% lone parent households where the parents were separated. You talked about, both parents being together and that. So I just would be interested in that circumstances and the response and the struggle in lone parent houses, and most often it's a mother who's parenting alone. But I suppose also in the approach, and it's important to have the reinforcement and the support for the young person. But the risk is with young people who commit acts of violence, either at home or outside, but when that's challenged, sometimes it can be turned inwards. And there is an increase, and I just have it here, in terms of male self-harm in recent years, and I think the incidence of self-harm in 2012 shows us a 20% increase on 2007 for males, and that's from the National Suicide Office. And I suppose the attempted suicide then is higher among young males and up until 25. So the challenge with any intervention is that it can be internalized, and we have to be careful, I suppose, not to result in that the young person harming themselves. And that's why I like the bit too about the support and the reinforcing rather than positive support and engagement.
I mean, that's something that would be checked in on all the time. Our facilitator would ask, is there any evidence? While you can't use an excuse for it or whatever, but you'd sort of remind the parent to keep an eye on the child's mental health. That very definitely. We're not expert in mental health. It's just about dealing with the parent. But as I said, you'd remind them to keep an eye on things like that. And if the violence didn't stop, well, then you might say there's something else here. So you might suggest that they go somewhere else. In terms of single parent, there's slightly more parents parenting alone, or mothers parenting alone, but only slightly. In a huge amount, I can't remember the figures off the top of my head, but there are a lot of dads around there, and there's a lot of situations where mum and dad are both parenting, but they're not together, and so it's all everybody. And the other thing to say is, from a sort of social class situation, we would say they're probably the better off and more educated people, slightly more. So. No, it's not an increase, but that's what's coming through in the MVR. There's no, we can't. No social divide. No, none whatsoever. It sort of, I would say, reflects the population. Yeah. In fact, that's the case with all parent line calls. There's no social divide there at all. I'd say, it's anonymous. We don't know who they are, but just based on things like, can I suggest a counsellor? Yes, I've no bother paying for a counsellor, whatever. We would say there's no shortage of money there. And I'd say slightly more sort of ABC1 social categories.
Any other questions? Actually, Rita, I have a question. Yeah. You said when you were speaking that the breakdown in calls between calls about boys are about 55% and girls are about 45%.
Yeah, that's on the NVR. But on the calls to parent line, it's exactly 50-50.
Okay. Well, I got the impression that most of the calls are coming from mothers, is that right?
Oh, absolutely. It's 86% to 14%. Yeah.
My question was for Philip, sorry. I was just wondering, work with a lot of clients that are saying they're smoking weed, but I've concerns about, is it weed? Like, is there still a lot of head shop stuff going around, or?
Yeah, we do drug testing, and I mean, off the top of it, there's one person we're dealing with at the moment, and he's come because he's smoking cannabis, and he's negative for cannabis when you test him, which suggests he's smoking something, but it's not cannabis. But that's quite unusual. We've published research where we look at the kind of rates of young people with head shop use, and it's greatly decreased since the ban came in, whatever it was, 2010. So, off the top of my head, I don't think we've had anyone for the last 1 or 2 years where the head shops were something that was deemed a problem, like they were doing it regularly. We've met lots of kids who've tried it once or twice, but there seems to be plenty of cannabis out there. So.
Have you noticed a change in the kind of present behaviours, so with the teenagers, and I have my gone through kind of from the hash to the marijuana to the weed now. But I definitely see like different highs nowadays, like more chemical based rather than
Yeah,
the stoned based.
I mentioned the connoisseurship kind of, you know, and like some of the kids would talk, and I can't remember off the top of my head, but some of them would talk, there's like two very, somebody here's going to quote me now and kind of get me, I'm not an expert on this, but there's indica and sativa, there's two different kind of versions of cannabis plants and all that, and some of the kids would say that if you smoke one's a mellow high and it's kind of, you just chill out, and if you smoke the other, you get a more giggly kind of, nearly a hyper kind of high, where you're kind of messing and stuff. Now, I don't know whether that's more in their imagination and it's kind of, they're in a social situation or a humour that brings them that way, as opposed to the drug, but I don't know. Days.
Des Corrigan is my name. I have a question for Philip, which sounds provocative, but it's not. But it's not actually meant to be. Of all of the people, not just the 8 in the qualitative study, of all the people that attend Yoda, how many in the last year have you reported to the Gardaí as being drug users and potential drug dealers?
Yeah, none, ever.
So the legal status of cannabis is not a barrier to people accessing treatment?
No. No.
Thank you.
Yeah.
Is that a policy, sorry, that we don't?
Well, the normal policy we say that is that we report, the standard one that most social care and counselling professionals be aware of, we'll break confidentiality if we believe that you are a risk to yourself or a risk to others. Now, I know you could argue, well, in theory, that if they're drug dealing, they could be a risk to someone. If a kid said to me, you know, he's going to go out after here and he's got to collect a debt and he's got to go beat the crap out of someone, I would report that. But it's never actually come up. They're smart enough not to tell us that. But it's the HSE policy that you break confidentiality for immediate risk to the client or someone else. So we don't need to break it. We don't report. We have to report everybody if it's crime, because like every single one of our clients is breaking the law.
Hi, my question is for Rita. I'd just like to know, in the calls that you get from parents in relation to abuse or violence, would substance misuse be a factor in many or all of those calls?
Some are. A lot of it seems to be around ADHD, dyspraxia, that sort of thing, rather than substance. But there are some substance misuse. We find we get less and less calls about substance misuse over the last number of years, and I think that's because there's more services out. You know, there's more awareness. I think that's my feeling.
I would just wonder as well. I mean, like I said in the study, a lot of times with parents, you know, they've been dealing with what they would see as difficult behaviour for 2 years, and the kid is up to their neck in trouble, and they just didn't realise it was drugs.
Yeah,
so there's quite a chance that parents are ringing you about aggression, not realising there's drugs involved.
Yeah. And the drug one that we get most often is, I found tobacco or I found tinfoil. What's this? You know, and I'm often thinking, did you just never see it when you were kids? You know, but.
Yeah, I suppose my question is for Philip. I work with a lot of your colleagues from the SASE service on the north side, working with young offenders who are very heavy cannabis users. I suppose in terms of that piece around talking to the young person, especially that 12, 13, 14-year-old around cannabis use, because they still see it as very cool and they like the buzz they get off it. In terms of the negative, even the health effects wouldn't really wash with them. In terms of trying to have that conversation about the negative effects of their use on themselves and the community, what angle do you think you could come at that with them in terms of any advice or a discussion you would have with them?
I think, you know, I suppose if you're talking about kids who are already using, you're back to motivational interviewing is really the thing you need. One of the biggest problems, I think, is that people think that education is going to be the answer, and you end up with some very well-meaning either parent or family member or teacher or profession of some description trying to educate kids about the harms of drugs. And so The kid, every time they're coming up with their statistic from the World Health Organization, the kid is going, yeah, but it's legal in Colorado, and they're not really listening to it. And actually what the kid is doing is he's rehearsing all the reasons why he should use cannabis and why it's not a big deal. So my big thing is that people need to be more aware of those MI techniques where you're trying to elicit from the kid, well, why might you not want to do this, or what problems might it be causing? And the word addiction wrecks my head. None of the kids I meet will, while they'll sometimes say, oh, maybe I am a bit addicted and stuff like that. If you say to a kid, are you addicted? No. Do you have a drug problem? No. Does your drug use cause you some problems? Yeah. But it's just that word and phraseology they just don't like. And I mean, like, our building is a big sticker on the end going addiction services, and the kid will go, we're at the wrong building, Mum, I don't know why we're here. So it's just a problem, I think, of how you present it.
Could I just add to that? I know in the work that Paula and I do with young people, that the kind of the approach that you're talking about there, with a group of young people, we will divide them into two groups, and rather than ask them what are the problems associated with cannabis, we will say to them, why do people give up cannabis? And they've to come up with the reason why somebody would give it up. So, and then they're always kind of debating with one another. They want to get the most reasons why. So this great competition goes on, but you get a great opportunity, from that angle. We have found kind of it has really worked with us. Could I say one other thing as well, just in relation to this morning and the decriminalisation piece? I know Philip was involved in the debate yesterday, and I was at the Richard Branson one. I was on the panel there. But when we're talking about that we're opposed to decriminalisation, we say we would prefer the alternatives would be that the young person's crimes would be expunged. So there is the second chance legislation there. If you're under 18 and you haven't committed a crime in 3 years, and there's three stipulations, you can actually have the charges automatically gone. The second chance legislation, the spent convictions as they call it, for adults has gone back to the drawing board briefly. They're hoping in a few more months we'll have that out as well. So that will give adults over 18s an opportunity to set the record straight, and which is good. But what I learned, what I didn't know, and I don't know whether you know about it, is the Irish Association for the Social Integration of Offenders. People heard about that? Heard their annual report 2 weeks ago, and I was raging. I hadn't heard it before the Richard Branson thing. But there's a documentary coming on. We've been involved in the making of a documentary that's coming out in November, the Reality Bites Thursday night documentaries. It's going to be about decriminalisation and people who are informed or opposed. But just to go back to the social inclusion of offenders, they helped 1,200 people in 2014 find employment in construction and manufacturing in Ireland. They helped 2,000 people, and these are all offenders, with education and training opportunities. So the next time somebody throws that at you, that it's so hard to get a job with convictions and all of this, that we can actually say, well, do you realise there's a huge amount of good things happening in this country? The school completion programmes are doing an excellent job. They've brought down the figures who are leaving school and that. I know it might be only slightly, but it's still kind of the right trend in that. So they're just things that we have found helpful because we have come out, we're one of the few agencies who have actually come out and said, no, we're opposed to decriminalisation. On those grounds, that we think, the reason we're opposed to it is we think perception of harm will diminish, use will increase, and problem use will increase. That's the basis that we've formed our argument.
Any other questions? One more here.
Thank you. And this one is to Philip. And I suppose, I have lots of different questions, so there's no point in me bombarding you, but I just was looking at the study. I suppose it's 8, and I was struck by the fact that 2 out of the 8, which is 25%, one had taken it from his brother, and the other one had got it through a neighbour. And I suppose when you're looking at young people's access into substance use, I suppose what percentage would you have of young people within the service where there's a history of substance use in the family, or where there's a history of parents or siblings linked to adult addiction services specifically? And I ask you that because I have our own data. The other thing I was kind of interested in too, because it has been significant over the past couple of years, while getting involved in drug dealing and indebtedness, we've had a number of young girls who are absconding and even up as far as Northern Ireland and Belfast, and making links with adult males through sites called, Friends with Benefits and things like that. So that's the risk area for young girls in terms of indebtedness and trying to manage that. But also then within the Adolescent Addiction Service, what we're finding, and similarly to what you seem to be saying, Philip, is that young people are using substances for quite a period of time before they're referred. Nearly 2 years, and we would find that too. It's between a month and 4 years. So there's a need for emphasis to elevate concern among non-parental adults and among parents and things like that of issues around substance use, and to increase their alertness. Now, I don't know what percentage that you have who are out of education. You talk about young people playing football and rugby and different things like that, so it may be a different cohort. But we would have 29% of young people, and it would be similarly last year, who are of school-going age and are out of education at time of referral and subsequently may get into other. And so that's a very high risk. In addition to the average over the 19 years has been between about 70%, it has gone to 75 or 64, who have a current or previous contact with cannabis. So you're talking, if I give you the figures that I mentioned to you before, where there's a high percentage of lone parent households. So you're talking about a number of risk factors, and to be vigilant in that circumstance. If a young person has a pre-existing mental health issue, where there's the challenging to parent alone, where there's a poverty issue, and where the young person's attendance and participation in school, and Trutz and Prochaska did some research around this in 2010 and indicates that young people who are not participating in mainstream education are a very high risk group. So I suppose just those factors. Yeah, okay. I don't know what you can take from it.
I suppose, unfortunately, I don't have great data up to date on things like, for example, family history of mental health, family history of substance abuse and things like that. We have been debating, should we be more rigorous in screening for it? Because we've had situations, like where you're talking to a kid and 4 months later, he says, I had a slip last week, and you go, I smoked some cannabis. Where did you get it? Mam's supply. What? We didn't know about this. And so it comes up every now and again kind of as an accident, and we don't deliberately kind of ask it all the time. We will sometimes, but we don't all the time, and it's not recorded in a very structured way. So it's probably something we need to be better at. It does come up more so that you have a lot of siblings who are misusing. So you often meet a 16-year-old whose 18-year-old brother is up to his neck in it and all that sort of stuff. So it is definitely an area. I mean, most young people get cannabis and any other drugs they use from mates and kind of similar age peers. It's not getting it from Nidge and Alexis outside the school gates. That's not kind of what's happening. In terms of education, again, I don't have great figures. I know at one stage we had figures very similar to you. I think it was 32% were out of education, had left school early. We would have some people, you see, who have left school at, say, 17 and they're attending our service, but they've done their leaving cert, but they're still not gone on to further education and they're unemployed. My impression is that over the last 10 years, we would have had 10 years ago, lots of guys could have just dropped out of school at 15 or 16 after they'd done the junior cert, walk onto a building site and get 400 or 500 euros in cash doing labouring. Those opportunities are gone. So it seems to stem the tide a little bit, I think, but I don't have great figures on it. Is there another bit I was to address?
No, just in the terms of a I didn't give the figures. The average would be about 24% where there's a history of parent or sibling contact with adult addiction services.
Yeah.
It ranges then between 48 and 64.
Yeah.
So the average then would be about 55% where there's a history of any substance use.
Yeah.
So it's very high.
Yeah.
And I suppose in that context, the need for systemic intervention is essential. And I just was struck by the fact that you were saying that not always are parents involved or get involved or participate.
Yeah.
Because, I would suggest really where young people are involved, there needs to be a more robust effort to engage parents and extend around those interventions.
I'll take that one and say that there is a robust effort. We can't ensure parents get involved, or parents don't, say, well, I can't come because I can't get time off work. We'd also have a number of young people who don't have parents who are in care and their parents either have passed away or whatever else. We do make every effort to get parents involved. Even when they're separated, we'll try and get, say that they live with the mum, but we'll try and get the dad involved. So there is an effort on our behalf. It doesn't always work. You did mention psych diagnosis or psychiatric diagnosis, so I will come back to that one while I remember it. In a study we did a number of years ago, I mentioned a slide there briefly, 38% of young people who come to our service has a previous diagnosis of a mental health problem. So that's one where they went to either a GP or a psychiatrist and got a diagnosis. And we would diagnose about another 10 or 12 with new kind of diagnosis. So that means that about 50% of them have a formal diagnosis, and there's probably a fair bit of underdiagnosing in that. So that's conservative. All right.
Okay, I don't see anybody else clamouring for the floor, so I might take the opportunity then to just jump in and maybe wind up. I really just want to leave you with one thought. It's been a tremendous day. For me, it's been hugely informative, it's been hugely educational. And I started out this morning talking about the need for evidence-based policy making, and in fact a number of speakers also alluded to this. And I think we've had a huge amount of evidence presented to us during the course of the day. I don't pretend that it's the only evidence that's out there. I'm sure there's lots of other evidence around, but it's nonetheless a very important contribution to the debate. But accumulating the evidence is actually only one part of the battle. The next part of the battle is how you analyse and interpret that evidence and what you actually do with it. The Minister said this morning before he left us that he looked forward to receiving the results of the report on the outcome of today's proceedings. So my message, I suppose, to the Minister, and maybe one that CAD might want to deliver to the Minister, is to take that evidence and to use it wisely. Because only then will we get the type of policies that society wants and needs. I think all I have left to do really is just to thank all our speakers today, particularly thanks to Philip and Rita this afternoon, thanks to Reilly and thanks to CAD for organising the conference, thanks to you for coming and participating in it. The end of the programme here says feedback and questionnaire, and I suppose really what Reilly wants me to do is to remind you that in your pack there is a questionnaire, and maybe just take a couple of minutes to fill it in. I also understand there will be certificates of attendance available on the way out. They're here at the door as you leave.
Can I just thank Anthea and Paula for the amount of work that went into putting today together. I know you mentioned and the team, but just to, I think you definitely, thanks very much. It's been
He's kind of
one or two people might like to say something, just in some feedback. Just
sure. No, just one other thing that I wanted to know, because I'm very conscious to even from our own phone calls and from talking to some people from different parts of the country today, and that's the great thing about an event like today, so congratulations on it. But I'm very conscious that there are lots of communities that don't have services available to them. And I think that's another part too that needs to be consideration. You know, while we've had a harm reduction framework, it hasn't been, you know, there isn't a strong and robust policy around it and understanding. And I'm very reassured by Professor Kaminsky's 2 words on that this morning around health and well-being, because that's where we need to shift more towards health promotion and well-being, and you know, to look at things on earlier intervention. But I think also that broader communities need to be supported, because there's many communities not too far from our own who don't have any services.
Would anybody else like to say anything else about today?
Thank you.
No.
All right.